Hello, everyone, and welcome to the age 26 through 49 adult expansion webinar. We do have a lot of information to cover today, so we do want to go ahead and get started. It is just now a little bit after 11. So we're going to first start with some housekeeping items. So today's meeting does have live interpretation in Spanish. There's a globe at the bottom of the page where you can select that and then select Spanish. So we are going to be talking a little bit slow just so that we have time to allow for the Spanish interpretation. We have enabled the Q&A functionality to ask questions. If we do not respond to your question during the webinar, we will provide a response via a Q&A log after the webinar. So now I'm just going to give a few seconds here for the Spanish channel to also get some instructions on their side. Okay, next slide, please. The adult expansion will implement on January 1, 2024, and will provide full coverage Medi-Cal to California residents 26 through 49 years of age, regardless of immigration status, so long as they meet all other Medi-Cal eligibility criteria. With this expansion, full coverage Medi-Cal will be available to all otherwise eligible Californians, regardless of immigration status. The governor's budget estimated the adult expansion population to be about 707,000 individuals. Next slide, please. Thank you. The Adult Expansion Authority, so Senate Bill 184, Chapter 47, Statutes of 2022, amended Welfare and Institutions Code Section 14007.8 to expand eligibility for full scope Medi-Cal to individuals who are 26 through 49 years of age and who do not have satisfactory immigration status. We will also refer to that as SIS throughout the webinar. And this is as required by Welfare and Institutions Code Section 14011.2, if otherwise eligible. So we have two impacted populations. There's the new enrollee population, and this consists of individuals who are 26 through 49 years of age in January of 2024. These are individuals who are not currently enrolled in Medi-Cal and who apply for Medi-Cal starting January 1, 2024. They must meet all eligibility criteria for full scope Medi-Cal except for SIS. In addition to new enrollees, there is the transition population. These are individuals who are currently aged between 26 and 49 and are already enrolled in restricted scope Medi-Cal because they do not have an SIS or are unable to establish SIS for federally funded full scope Medi-Cal. These individuals will transition to full scope Medi-Cal when the adult expansion implements on January 1, 2024. Next slide, please. The transition process. So the expansion transition population in restricted scope aid codes will be moved into corresponding full scope aid codes for the January 2024 month of eligibility as follows. Beginning November 21st, the California statewide automated welfare system will process transitioning batches. And then beginning December 1st, DHCS will process transitioning batches for individuals who did not successfully transition to full scope by the CalSAWS batches. This DHCS batch will ensure that all individuals eligible in restricted scope aid codes will have full eligibility beginning January 1, 2024. Adult expansion aid codes. So there are no new aid codes for the expansion. Individuals who are eligible under this expansion will be placed into existing full scope MAGI and non-MAGI Medi-Cal aid codes. For the transition population, DHCS has developed an aid code crosswalk that identifies the appropriate full scope aid code for eligible individuals in restricted scope aid codes to move into once the expansion is implemented. This aid code crosswalk can be found in the eligibility and enrollment plan on the adult expansion webpage. Retroactive Medi-Cal. So applicants have the option to request retroactive coverage for up to 3 months prior to their application month. However, under the new age 26 through 49 adult expansion, full scope retroactive coverage will only be available from January 2024 onwards. So it's important to note that if eligible individuals request retroactive coverage for any months preceding the implementation month, they will only be granted restricted scope Medi-Cal eligibility. So this is based on the rules that are in place prior to the implementation of the adult expansion. So for example, if somebody came in on January and requested 3 months retro, they would receive restricted scope retro for those 3 months prior. If they came in on February and requested 3 months retro, they would receive full scope retro for January and then restricted scope retro for December and November. Immigration status. Applying for or using Medi-Cal does not impact an individual's immigration status. The U.S. Department of Homeland Security and U.S. Citizenship and Immigration Services do not consider health, food, or housing services as factors in the public charge determination. By incorporating this vital messaging into our outreach materials, the department is emphasizing California's commitment to ensuring access to healthcare for all, regardless of immigration status. This messaging aims to dispel any lingering fears or misconceptions, promoting greater participation in Medi-Cal's comprehensive healthcare services. Stakeholder engagement. So provider and Medi-Cal managed care plan updates. DHCS will post a provider bulletin on the Medi-Cal provider website in the October bulletin. We will also be posting a reminders newsflash in November and December. DHCS is using existing stakeholder engagement forums to discuss and provide updates on the expansion implementation, including but not limited to the Adult Expansion Stakeholder Work Group, the Consumer Focused Stakeholder Work Group, County Welfare Directors Association of California meetings, Managed Care Operations Plan conference calls, and Medi-Cal Dental Advisory Committee meetings. So expansion noticing. All notices have been translated into the threshold languages. The first notice as well as the FAQ also went through user testing. So the first notice is a general information notice and FAQ that will be sent to existing beneficiaries in restricted scope aid codes who are identified as part of the expansion population. DHCS will send the notice October 23rd through November 3rd. For new applicants that apply beginning October 1st through December 31st, the county will include the first notice and FAQ with the application materials. The second notice, these are notice of action snippets that will begin to be sent out the end of November when individuals begin to transition to full scope for the January 2024 month of eligibility. And then we have the third notice, and this is a managed care enrollment notice. This is also going out to that transition population. So then here we have the first notice and FAQ in English. We will be posting this webinar on the DHCS webpage so that you can follow these links. However, this notice is already published in all threshold languages on the adult expansion webpage. And the FAQ is currently in the process of publishing, and we're hoping to have that up by the end of the week. So next up, we have our teammates over in managed care enrollment that are going to come and discuss the third notice. So Angelique, I will hand that over to you.
This is Angelique with the Managed Care Operations Division. We're going to discuss the third notice, also known as the Managed Care Enrollment. Medical healthcare options will be mailed in the third notice. Notices will include a link to the FAQ that will be posted on the DHCS. A written copy of the FAQ will be mailed to members upon request. The notices direct members to call healthcare options if they would like to receive a written copy. Thank you. Notices are expected to mail November 27th to be in hand December 1st. Notices will explain what the Medi-Cal health plan is and will differentiate depending on whether the person is in a COS/single plan county or a non-COS/non-single plan county.
Angelique, we're having some difficulty, I think, kind of hearing you. You're kind of going in and out.
And better. I'm in the office. I don't know how to see it.
Yeah, we can't, it's like kind of muffled. Try it again.
That is better.
Nope, just sounds like you're really far away.
Mm-hmm.
Technology is so great when it works right.
Just unplug. Okay. All right. Okay. Can you hear me any better?
Yes, that's great.
Oh, let's just unplug and replug. That's always nice. Okay. Would you like me to start from the top? If it was too difficult here.
Yes, please.
Alrighty. So I'm going to be covering the third notice first. So Medi-Cal healthcare options will be mailing the third notice. Notices will include a link to the FAQ that will be posted on the DHCS website. A written copy of the FAQ will be mailed to members upon request. The notices direct members to call healthcare options if they would like to receive a written copy of the FAQ. Notices are expected to mail November 27th and be in hand by December 3rd. Notices will explain what a Medi-Cal health plan is and will differentiate depending on whether the person is in a COS/single plan county or a non-COS/non-single. If a member lives in a single plan county or a county that has a county organized health system, they will be enrolled in the COS plan, single plan, or Kaiser Permanente. If the member county has more than one Medi-Cal managed care plan, they will get information on how to choose a new plan. Enrollments into COS and single plan managed care plans will be automatic and take effect on January 1st, 2024. In non-COS/non-single plan counties, Members have Medi-Cal health plan options and will receive a choice packet, which they will use to select their health plan. Members can choose an MCP or managed care plan as early as January month of enrollment. The default enrollment date is February 1st, 2024 if the member does not make a plan choice. So now we'll cover Medi-Cal choice packets. Medi-Cal healthcare options will begin mailing Medi-Cal choice packets to the transitioning population in non-COS/non-single plan counties in November 2020. In non-COS/non-single plan counties, members have a choice as to what managed care plan they will enroll. DHCS will default assign beneficiaries in a family to the same plan unless beneficiaries can also affirmatively choose otherwise. Choice packets include an enrollment choice form, a self-addressed stamped envelope to return the completed form, a Medi-Cal managed care plan enrollment choice booklet that provides plan information, guidance on how to enroll in a Medi-Cal managed care plan or change plans, the healthcare options presentation schedule, a summary list of Medi-Cal managed care plan benefits, instructions and forms for the medical exemption request/waiver, and a Medi-Cal managed care plan provider directory for their county if approved. Again, members can make an active plan choice for enrollment as early as January 1st, 2024. Members' default enrollment date is February 1st, 2024 if the beneficiaries do not make a plan choice.
Thank you. So next up, we have outreach. DHCS is in the process of developing a comprehensive global outreach toolkit. This toolkit, which will be made accessible in all threshold languages, will serve as a crucial resource for counties and partners. DHCS strongly encourages our partners to incorporate the toolkit messaging and resources into their respective outreach endeavors and social media campaigns. DHCS will share the global outreach language broadly for use by Medi-Cal managed care plans, other state departments, Medi-Cal providers, and other community partners for use in their outreach activities. The goal is to empower our partners to enhance their outreach activities, thereby further extending the reach of the Adult Expansion Initiative. So next up, we have a presentation on outreach from our vendor GMMB. So Stefana, I will hand it over to you.
Actually, I'm going to kick us off, Jillian. You can hand it to me. This is Tracy.
All right, Tracy.
Okay, so as everybody knows, we are heading into the expanded eligibility portion of this overall campaign beginning in November. That, of course, will run through May of next year. So heading into this this section of the campaign, we conducted some testing of materials that we wanted to share with all of you, the process there, and then also the findings and the feedback that we received, which then influenced the materials that we are putting out. So first of all, we focused our efforts on testing both content and design of two pieces. One is the flyer that we're making available to partners and for use sort of broadly out in the community, as well as the first notice, which will be mailed to folks. We had 11 ambassadors participate in virtual interviews with our team to provide feedback on both pieces. 4 of those ambassadors were member-facing and 7 were non-member-facing. We wanted to make sure to hit both. We then asked 5 community partners to facilitate in-person, in-language interviews with members of the targeted community to get their feedback on both pieces, the flyer and the first notice letter. And we did that in 5 languages, which you see here: Spanish, Chinese, Korean, Vietnamese, and Russian. In terms of what we learned from these interviews, both of potential members and the ambassadors, first of all, it's very clear that folks are very happy about this expansion. The hurdles that folks face won't be a surprise to anyone on this call. Long wait times, work hours, lack of childcare, lack of transportation, all provide hurdles essentially, or impose hurdles to enrollment. Many folks appreciated that in the materials that we tested, we were very clear to make it clear that Medi-Cal is not considered a public charge determinant. That came through loud and clear, and so we've made sure to carry that through in all of our materials. And folks said pretty much across the board that community assistance is vital to explaining the process, to assisting with forms, and to troubleshooting services. And that folks are really more likely to seek help from trusted organizations and community members rather than go to local Medi-Cal offices. So in terms of some specific learnings on our materials, you see here the flyer. And this again is kind of the things that came through across the board as kind of applying to everyone who we talked to, including the full list of Medi-Cal services, of course, rather than just naming a few as examples, was really important. We had a few versions of this flyer, some of which were bulleted, some of which were more narrative. The bulleted presentation of services was strongly preferred. Including a phone number was also strongly preferred. And as you'll see, I know it's small, but at the bottom, we have a place between the logos and the state seal for local organizations to add their phone number to the flyer. Folks said the state seal adds a lot of legitimacy to this, particularly in an environment where we know there's fraud happening out there. And people also really appreciated the inclusion of both a URL and a QR code in case they're seeing this on the go and can just snap a picture of it with their phone. Very, very helpful. So we've included that as well. On all of our materials, we have used ethnicity-specific photos, of course, rather than animations. What we had tested two versions, one with animations that could pretty much broadly apply, and one with photographs that really represented folks and their communities, and the photos were strongly preferred. So you will see those on flyers in all 19 languages. We also heard loud and clear that next steps should be clearly outlined. That will mostly come through in that first notice letter, but obviously making it really clear what needs to happen and where to go for help. We asked ambassadors in particular what materials would be most helpful to your organization when conducting this outreach. Clear, simple, in-language materials that are DHCS branded, so there's no confusion. Once again, making sure to reassure folks right off the bat that immigration status does not matter and that Medi-Cal is not a determinant for public charge. Folks asked for flyers and posters, the flyers we are providing, and suggested ads in ethnic newspapers, ads on in-language radio and social media messaging, all of which we have worked into our plan. I will hand it over to my colleague Stefana to walk through paid advertising.
Thank you, Tracy. So first thing is we are doing targeted paid advertising. This will be a statewide paid media campaign, which will run from November 2023 through May of 2024. Through targeting, we will reach potentially eligible adults in all 19 threshold languages. The plan will feature ad placements in print, digital display, digital video, social media, search, out-of-home display in locations where we expect this population to be, and streaming channels. The digital and print ads will connect people to the expansion landing page, which is also the URL you saw on the sample flyer on the last slide, and I will show to you shortly. In addition to those targeted advertising tactics, we'll also be leveraging earned media tactics. First, we'll have a mat release in English and Spanish. A mat release is a pre-written article that will be placed in relevant publications and explain the expansion process. In addition, we'll have a 30-second audio news release in English, Spanish, and Mandarin, so that will be on traditional radio stations. Finally, we will be doing a briefing for reporters via ethnic media services with simultaneous translation in Spanish, Mandarin, and Korean to ensure that those community publications can reach their population with accurate information about the expansion. Finally, we have direct outreach resources. These are resources for ambassadors, navigators, and other community partners to use to communicate with potential members about the expansion. Based on the research that Tracy presented earlier, we will be providing a suite of resources about expansion. This includes key messages. There will also be a video from our advertising campaign that we'll make available for organizations to share. Flyers, both targeted for potential new members and for existing members who are being transitioned. Call scripts, email copy, web copy that can be used by other organizations on their websites, and social media graphics and copy. I'm showing 2 examples here of the social media that will be available in the resource hub. We're also launching a specific landing page for Get Medi-Cal expansion campaign. For this landing page, we've created a .gov vanity URL that will be easy to remember and redirect to the new landing page, and that will be available in both English and Spanish and provide not only information about this expansion, but how to apply. In addition, we're creating a dedicated Get Your Community Covered resource hub. This will be separate from the Keep Your Community Covered resource hub, but they will be linked together so ambassadors, navigators, and other partners can access resources from both easily and see the difference between the two. I'm going to stop sharing this screen and start sharing my web browser so I can give you a quick preview. This is the new Get Medi-Cal Covered landing page. As you can see, it has information about how to apply and 3 current expansion programs. This is also going to be available in Spanish. If you click here, that page is still in development. Here's the specific expansion page in Spanish. You can see it goes over the details of the expansion program and makes it easy for individuals to apply. Finally, here is the Get Your Community Covered resource hub. You can see the section for adult expansion with the 3 graphics I showed you earlier. Additional resources will be added to the hub in the next couple of weeks, including all 19 languages that are in translation now. With that, I will hand it back to Jillian and team.
Okay, so next up we have our health enrollment navigators. So I'm now going to hand it over to Nancy.
Hello, everyone. I'm Nancy Ojeda with the Medi-Cal Health Enrollment Navigators, and I will be providing some information on the project partner efforts as well as some information based off inquiries received. The Health Navigator project partners do leverage GMMB outreach resources. DHCS ensures that project partners stay apprised of GMMB developed toolkits. We review materials and information and notify partners of the information and tools available for their use. Additionally, through emails, monthly meetings with partners, and other communications, we provide partners with the outreach information and review the benefits of using the materials developed by GMMB, as well as point and provide information on how and where which materials are which materials can be modified as necessary to target their local efforts. Next slide, please. Currently, the Health Enrollment Navigator project are using targeted outreach and focused activities. Some of the locations where partners go to serve hard to reach populations are through established community events, such as food distribution locations, places of worship, school campuses, swap meets, farmers markets, community centers. They go out to the farms and the fields, health fairs, public events, movie theaters, grocery stores, panaderias, which are the Mexican bakeries, and they leverage social media. Next, thank you. Our project partners have identified using the following targeted languages for outreach efforts. They have English, Spanish, Mandarin, Cantonese, Tagalog, Vietnamese, Farsi, Cambodian, Korean, Mixteco, Russian, Arabic, Chinese, and Hmong. DHCS Health Navigators Enrollment Project does have a landing page. It is found at the link here. We provide links and information, resources, and tools for others to leverage, as well as we have a tab for local partner events. That tab will provide information on events that our partners are either attending or hosting. It also serves as a centralized source of events and is routinely updated for a 3-month preview. Any advocates that are in attendance today, we are asking that for you to help spread the word regarding our webpage and the tab specifically for community events. And again, the link is here. And one more. Okay. And the in regards to demographics and the population served, the Navigators Project has collaborated with the project partners and provided information and data in regards to the language threshold languages by area and by county. We do encourage partners to look into servicing other languages when possible, and DHCS frequently reminds partners that they can adjust their line items within their existing budgets to adapt for changing approaches and their local implementation needs. There is a note that we do have to, that DHCS does have to approve any changes to partners' budgets before implementation. And that is all from the navigators. Jillian?
Thank you. Okay, so next up, we have the resources, but first I just wanted to, I'm getting a lot of questions that are coming in about how folks are going to have access to this webinar. The slide decks will be posted to the adult expansion webpage. So everybody will have access to the slide deck. For those outreach materials, I'm getting a lot of questions on how folks can access those. And we will also have a link on the adult expansion webpage that will take you to that where you can access those materials. So for resources, I've talked about this page quite a bit. It is the DHCS Adult Expansion webpage, and this is the link right here. This provides expansion publications and information. And then we have ACW DL-23-08, which provides policy guidance on the expansion. And then also to learn more about public charge, we wanted to include this California Health and Human Services Agency Public Charge Guide. I'm also getting a lot of questions kind of about how to help people navigate kind of misinformation about public charge. So this is a great resource to direct them to. I believe there's also links to community partners that can assist with immigration information. You can also find this information on the adult expansion webpage. And then for questions, so here is the email to its adult expansion at dhcs.ca.gov. So if you have any questions about the expansion, you can send that over there and we can get back to you all. So we are still getting quite a bit of questions in that I do not think we have folks on the line that can assist with those today. So I will be taking those back and providing a Q&A log to the participants with formal answers for those questions that we're not going to be able to answer today. I do appreciate everyone for joining. This is a very exciting project. The age 26 through 49 is our last group. And so with this implementation, everybody will be eligible for full scope regardless of immigration. So that's very exciting news and really offering comprehensive healthcare services to, all of our eligible Californians. So thank you again for joining. Thank you for all of the work that you all do out in the community. We will be hosting another webinar in December. And we will send that information out coming soon with that date. We will also post the link again on the adult expansion website. And with that, we will end a little early. Thank you again all for attending. Have a great day.